just going to give you a few more minutes to get yourself comfortable, and maybe some latecomers might come, so we'll just kind of hang fire a little bit. Maybe one more minute and then we'll start the show. Thank you so much for joining us anyway. You'll see a few of us here on the screen. I will introduce you to everyone, and there will be an opportunity for questions, which you can pop in the chat. But we'll just hang on one more minute. And while you're waiting, it would be really nice if you popped in the chat. Well, Hannah's already done that, just to say hi and introduce yourselves. Let us know where you're from. Let us know if you're a nurse, a midwife, a student, academic, clinician, where you work, where you're located. That would be really useful. It's very nice for us to know where you're from. Some of you may also already be members of Nursing Now Challenge, and some of you may be considering joining. But whatever category you fall into, you're most welcome, and you will always learn something new about Nursing Now Challenge. Nobody's done that yet. You're maybe feeling a little bit shy, but please do that. Right, okay, I think we can get going now. So welcome to the Nursing Now Challenge. This is one of our welcome events that we do. Oh, we have a wonderful guest today, Sana Gull, who maybe you've just knew from her award, from the Nursing Times Award, with her trophy from the other week at the big, very wonderful award ceremony. So welcome, currently studying midwifery in Birmingham, and she's a nurse from Pakistan. So welcome, Sana. Thank you so much for popping that in the chat. Lovely for you to join us. So the Nursing Now Challenge, for those of you who are maybe new to it, is a global community of nurses and midwives. About a third of our community of over 61,000 are students, and the rest are clinicians or academics. And today we have a special guest from our wonderful colleagues in Sigma, who have always been great supporters, hugely collegial, and a wonderful friend to Nursing Now Challenge. So we're really pleased about that. And we also have Aaron, who is joining us as the very newly appointed Regional Hub Lead for the Western Pacific region. And myself here, and it's lovely to see people coming in now. We've got Michelle, she's from Chile. Oh, lovely. So we have Lizette as an academic here in Edinburgh University. We've got Shazia from Pakistan. And maybe the Shazia I know, I'm not sure, pop that in the chat. And Ellen, who is from the Philippines, wonderful. So we've got a nice little group. And I think that's maybe currently working, Shazia working Kuwait, I'm thinking. Okay, so the purpose of today really is for you to get some insight into Nursing Now Challenge and understand a little bit of the organisation itself and what our purpose is, give you some highlights of some of the things that are available to you. This is a free community, and anyone can join if they fit the category I've just talked about previously. The joining process is very easy. You'll find details on the website, and I'm sure Hannah will pop those in the chat. You can join as an individual or an organisation, and I'll tell you a little bit more about that. But I just do want to I'll get our guests to introduce themselves now before I start, and then it just makes a slicker process when we move to them for their presentation. So we have Dr. Matthew Howard from Sigma. He's a director there, and he'll tell you a little bit more about himself. Matt, welcome. Can you just share with us a little bit about your role and what you're maybe going to talk about today, and you'll follow on after me in the presentations.
Perfect. Yeah, thank you, Aisha. Thank you for allowing us to come in and talk at this particular event. Like she said, my name is Dr. Matt Howard. I'm currently the Director of Scholarship and Leadership Resources at Sigma. I am, of course, a nurse by training. I have been an emergency nurse for a little over 25 years now. I've been with Sigma as a staff member since August of 2013 in various roles from manager all the way up to director right now. And I manage about 4 or 5 different departments within Sigma itself. One of the areas that I manage, that I'm over at least, is our Career Center, which falls in line with perfectly with the Nursing Now Challenge and that thought process. So we talk a little bit about our process, what we have done and what we have changed and what we have learned, lessons learned, if you will, over the last 5 years that we've been doing the program.
Wonderful. Thank you so much. And Aaron, do you want to say a little bit about yourself?
I don't know if there's a lot about me to say a little bit. Hello, I'm Tsung Po Huang, and I'm also known as Aaron. I'm newly the co-chair for the Western Pacific region. I'm from Taiwan. Yeah.
Lovely. Thank you so much for joining us. So I think I'm going to just go straight onto the slides here. If Hannah is able to put them up, and if not, I've downloaded them. So Hannah, just let me know if you've got them or you want me to put them up. Just hang on while that's happening, while I'm waiting on Hannah just to let me know. I can see we've got quite a strong representation from Pakistan, actually, and a couple of people in Kuwait City. We've got Nigeria, West Yorkshire, and Amy has joined us. Hi, Amy, Eastern Med, etc. I'm just wondering, might just see if Hannah has left me a little message about the no, I'm gonna see if I can just pop these slides up myself then. Okay, now this will be a thing to see if I can share this with you all. See if this works. Oh, I'm just checking people can see this.
Yep, you're up.
Oh, I'm up. Thank you so much. Okay, I'm going to just see if I can move it over to my screen here because that's where my camera is. That's much better. Perfect. Okay, so the size of this is just a little bit. Make that a bit smaller so you can see it. Okay, so the Nursing Now Challenge, this is our welcome webinar. As I said previously, we are a global network of students, early career nurses and midwives, and you can either be a clinician or a student, academic, and you can have you can be part of an organization or you can join individually. And I'm sure most of you will agree with me that this is a very exciting time, a very challenging time for nursing. And there are many things going on that geopolitical landscape that are impacting on our health workforce. And as the largest health workforce, that is nursing. So for us, we think this is a really opportunistic time for you, offering a space and a community to be supported, to feel part of something that acknowledges the contribution you're making, considers your development, both personal and professional, and enables you within a safe collegiate space to grow, to be nourished and nurtured. And actually that leads very nicely into our celebration on International Nurses Day, because we're having a wellbeing event. So it's our gift back to you, as Hannah, who's our Director of Comms, described, to say thank you for everything you've done over the year, and rather than asking you to do some more. So we hope that you will find it in you to join us, and we need more people. We need you. If you already have joined, then thank you so much for all you do, because you make it possible. And if you're considering it, please today ask any questions in the chat. We'll answer them, but hopefully you'll like what you see. So the network is global. We developed from the Nursing Now campaign, which was quite a few years ago now, and the leadership element continued under the new name of Nursing Now Challenge. So we have now 62,200 nurses and midwives from, we're over the 1,000 organisations. Wow, Faye's obviously been working on that data, because that's great. I've been saying just under 100 for so long. So 1,063 organisations, that is phenomenal, across 91 countries. Hospitals, universities, health employers, they all feed into our overall structure. So what is the Nursing Now Challenge about? Well, that's the thing. It's a very difficult thing to put on one slide, but we've tried to pull out some of the key elements. It's not all of them. And I think the Nursing Now Challenge may be different for different people. There are some elements that you'll see here that will offer more than others. And but I think there is a common theme that is spread across the challenge of the things that I mentioned earlier there about being part of something that really believes in you and wants to help you grow, develop, nurture, and does that by through various methods to suit probably your different learning styles and your different personalities. So the first thing that we offer across these 4 foundational pillars, within which there are a number of other resources and activities and opportunities, are resources. And actually, the great thing, we've got Matt here with us today, because he's going to talk about some of that. In fact, many of these 4 things actually are probably covered in what Matt's going to talk about. But these resources we bring from partners, collaborators, our members, our Challengers Committee, colleagues who are really supporting the regional hubs. So this is about strengthening your global network, and your network will be one of the key things in your development. It's very unusual to be able to do your job on your own, and I would say that for any job. But more importantly, nursing, the emotional labour of nursing is significant, and you need a support network around you. And that does not necessarily need to be the people that you work with, but that could be much wider, which what we would probably term a strategic network. It brings different things to you that you require at different times in your career. And that network changes. And what we can offer is a global network. So you may be based in Nigeria, and you will have somebody who's working with you on a piece of research in the UK or in Taiwan or somewhere else, or you have identified a mentor somewhere, or there's resources somewhere else. It is opening up a whole new world to you, I think, really. The second thing is the networking. How does that work? So being part of a social movement is something that we see gives strength and power to effect change. We saw that with the Nursing Now campaign. We see that with the work of Marshall Gans around social movements. We will be stronger bringing ourselves together. And that opportunity allows collaboration, both online and in person, but also allows us to consider those big global issues. So this morning, if some of you were on our webinar on misinformation and disinformation, we had people from all over the world, and we were talking about how can we best use social media in a way to ensure that information is correct around things like the pandemic, COVID-19, vaccinations, the Pandemic Accord, which is currently being discussed this coming week at WHO, a huge framework for hopefully the prevention of what we saw with COVID in terms of vaccine equity, safety for the workforce, our workforce, you who are in clinical placements and practice. We don't ever want to have to see that again, and this is an opportunity to do that. So together we collaborate and create this network, which is the very fabric of Nursing Now Challenge. And then there's leadership, which is a core element. And this is more than just doing a course or ticking a box. This is leadership in you leading yourself and being able to step out of your comfort zone in a safe place and feel like you are supported as you learn more about yourself and understand who you are, what your purpose is, and what that journey may look like, and what you might need on that journey. So there are opportunities to build on leadership development. So we do have educational packages that are experiential for you in your learning, but we also have opportunities for you to take part in events that also will offer you the opportunity to grow. So we do that through both local events, regional events, and then global events like we did this morning. And then finally, research and innovation. We asked some of our members what they wanted, and they wanted more on research capacity building. So we have been trying to do that through our 1000 Challenge program. I'll tell you a little bit about that later. And that's really to accelerate evidence-informed practice, evidence-informed policy, and for nurses and midwives and students to understand their role in leading nurse-focused research rather than being data collectors of other medical or health professions. So where do you fit? If you were joining, you would be part of one of the 6 regional hubs. These regional hubs map the WHO hubs. And obviously, you've had a chance to just hear a little from Aaron there. So you'll see his region is there. And each of the regions will have regional hub leads who will be engaging with you. At the moment, we are just transitioning into a new platform software that will allow us to engage with you further in a much more personal way and in a much more effective and efficient way. And that will also help our regional and support our regional hubs. So there's a little transition period at the moment that Faye is working on. There's our project manager in Nursing Now Challenge, and we're really looking forward to that probably in the next few weeks coming to go live. So what are some of the things that we're involved in that you could be involved in? So we are partners of the Global HPV Consortium. There are over 100 partners. And I think we are still perhaps the only workforce partner there. As you know, human papillomavirus is a global priority for WHO and member states to prevent the infection that causes cervical cancer. And in some places in the world, in many countries in Africa, for example, women of a certain age, it's the biggest cause of death, and we know it's preventable. And in some countries, we are seeing vaccination of men and women. So school children, my own sons have had the vaccine here in the UK. So this launched last year in September. The strategy was launched in January. And we ourselves are going to be doing a global solutions initiative around this in collaboration with HPV Consortium. So watch this space. That will be coming just, I think, around summertime. And then we have health action training, which is the educational element, which is run by Health Action Training. HAT is the name of the organisation that works with us to develop this. And these are webinars for general leadership development, courses, communication techniques, and then there are different levels. So that does go up to a postgraduate certificate, which is accredited. Now, the thing with these is you can join for a few hours or you can join for several weeks. Depends where you are in your career and what time and resource you're able to offer. But there are fantastic feedback from this, very inspirational. And I'm not sure if the video is on our website. I think it may be, but wonderful stories of people who've done this training, and it has transformed not just their practice and their career, but those of their colleagues, and transformed the work setting, the workplace, because people are communicating in different ways. They're more mindful. They understand what it's like to be part of a team and work together. And this is quite an unusual method of actor training and drama. And I had done something like this several years ago, and I was quite skeptical, and I did it, and it was absolutely wonderful. And I've seen the results of health action training. These are available. People sign up for them. Again, there is no cost to your organisation, so I would strongly encourage it. The 1000 Challenge, this is our research capacity building collaboration with the Global Health Network. And That is in its kind of pilot launch phase at the moment. So there are some research studies going on. You can register on our website or on the Global Health Network website to be part of the 1,000 Challenge. And this is for anybody. You can be absolutely have no experience with research at all. You can be a student, you can be a community health worker, nurse, midwife, and then you can, you will then receive probably, I would say, an individualized educational package that will take you right to the very beginnings of the research process, trying to define a research question, how you do that, literature reviewing skills, etc., ethics, protocols, etc., and also try and marry you up with a mentor in country or within institution. So it's fantastic, and we're looking to hopefully grow that across the globe in the next year to 2 years. And then the Global Solutions Initiative, you heard me talking about this. We have one at the minute, which is disinformation and misinformation. And we launched that in collaboration with the World Health Organization. So you'll see each of these elements of the Nursing Now Challenge are generally always in collaboration with global partners, health partners. And that's wonderful because that means we can bring in the expertise, we can bring in the knowledge, and it opens up your mind to the different actors and stakeholders there are that nurses need to be engaging with and know about. And you'll see on the slide here that our members have taken part in 2 webinars so far around the pandemic accord and misinformation and disinformation. How do we tackle it? And the session this morning was recorded. If you missed it, please join. Please seek out the link on the website. Hannah might put it in the chat here today, and watch it because you will really learn something. I learned so much today about how badly I maybe am using my LinkedIn account, for example, in hashtags. So you're never too old to learn new tricks. But it's wonderful. And the whole point of this is really looking to early career nurses for innovation and solutions to global health challenges. Not people like me, people like you. And for you to come together around a topic. And on our website, you'll see the different previous Global Solutions initiatives there have been. And in a way, it's a competition. At the end of the couple of webinars we offer, which opens up your mind to a specific topic, gives you practical skills, and then you would collectively, with a team that you put together, submit your whatever it is we're asking for. And in this case, I think we're looking for like a policy brief or some brief on using social media and what that would look like. And then the winner of that this time for this one, I'm giving you the example of, will pitch their idea to colleagues at the World Health Organization, not in person, sadly, but on a digital platform, Teams or Zoom. But that's a fantastic opportunity for someone. And what we learned this morning is that there were so many questions about this and so many considerations of what's nurses' role, how do we do that, how do we become experts at this, how do we, if we have a small group of followers, have we got presence? And there were so many great things we talked about with Alex, who's the social media manager at the WHO, and she works very closely with the Director General, Dr. Tedros. Follow her on LinkedIn, you'll see, and she's very helpful, and we are hoping to carry on that relationship. We also have something called the debates. These are webinar-like, but what we want to do with these, and we've not started running them yet, the first one will probably be in around summertime, maybe a bit before, although it's May already, so it's probably not that long. But we want there to be debate here rather than passive listening. And these are some of the topics we've come up with this year. And if you have any yourself, please get in touch and we can put them together. And these usually run various formats, but generally we have speakers, there's a panel, there's discussion, but we really want to push that discussion more into an action phase, an advocacy phase, an engagement with you. So really thinking about what's happening at local level and how we can work with the regions to support that. And I'll say a little bit more about, well, I might leave that actually for Aaron. He might pick up on what the regions are doing. And then we have our Nursing Now Challenge book club. we've had a first book club with Sarah De Gregorio, who is a journalist and has written a fantastic book, which was on my bookshelf here at work. But I think I've maybe taken it home or I've given it to someone to read. And that was wonderful with Jill White, one of our advisory board members, interviewing her. We've got another one coming up on the 17th of May with Catherine Trebek, and that's around health economics. Now you're probably thinking that's got nothing to do with me, economics, I don't know anything about it, but really it's about how we finance the world for a better economy, a better way of living. And actually as nurses, we are asking for investment from our organisations, from our ministers, and to understand what we're asking for is the key here. And we'll be talking about that and many other things. And this time, instead of it being a professor that is doing the interviewing, it's our early career nurses who are doing it from across the globe. So we're redressing the balance there. So please sign up for this. It's absolutely wonderful initiative that we have, and we try to, I guess, have things that meet the needs of all our colleagues. And as I've said, International Nurses Day is coming up. So in a couple of days, we've got the wellness event, and it's a celebration. And Hannah has put together a wonderful agenda for the day of various things around you and how you are the focus and how we are giving back to you. So we've got health action training coming in, art therapy, self-compassion sessions, all of those things. And then a real big highlight for us is, I mean, this really, I guess, falls into the debates, but we wanted something around the state of the world's nursing. And as some of you may know, this is a significant report. We had one before, there is a new one be ready in 2025. In 12 days' time, 2 weeks' time, many of the member states chief nurses from government chief nurses will be coming together along with partners in Geneva to discuss the data that's currently being collected across the regions. And Dr. Carrie McCarthy is the lead nurse for that at WHO within Workforce. This is a fantastic opportunity for you to hear from the person who's leading one of the most influential pieces of work that is happening in nursing. And she will talk about what state of the world's nursing is, why it's important. She will talk about the data that's being collected, why that's important, what your role might be in supporting your countries to do that. So I would not miss that or any of the ones I've talked about, and you can register. So thanks for listening. That was hopefully not too much detail, but enough to give you an idea that there's lots going on with the Nursing Now Challenge. And we would love for you to join us. We don't want exclusivity. We want you to join other organisations, also our colleagues in Sigma and different places. There's many things out there and you'll need many things for your career. But Nursing Now Challenge really is quite unique. And we focus specifically on early career nurses, midwife students. So hopefully you'll join us. Thank you so much. Just going to stop sharing my screen if I can get this up here. Ah. Okay, thank you so much. And over to Matt next, I think.
All right, thank you very much. Hopefully you're able to see the screen here. Again, I want to say thank you to Professor Holloway for letting us be able to come and talk about this one. And of course, seeing in the chat, many nurses here, of course. So happy Nurses Week to everyone, of course. And again, thank you for having us at this event. We've been involved, we Sigma have been involved in the Nightingale Challenge, Nursing Now Challenge, since beginning of 2020. Which has been really nice for us to be able to have this kind of outreach, this kind of educational information for everybody going out. So what I want to do a little bit real quick is just kind of give some feedback and update, if you will, in terms of what we have done at Sigma and the way that we have done things. Again, this is just one individual program based out of the hundreds of programs that are out there. But again, just gives you an idea of one thing that we have done. So a little bit of background on Sigma, of course. We're an international nursing organization, one of the largest behind ICN, one of the actual largest member-specific organizations in the world. Have over 100,000 plus members throughout the world itself in over 100 countries, which is great. In that, we get a good reach of individuals. So when we actually started this the first challenge itself with us, we had a lot of people that were interested in the programs here. We've had individuals from our scholars themselves that have actually gone through our programs, about 180 or so in the 5 cohorts that we've had. Again, we started one in 2020. We started another one in the middle of 2020 because we had so many people that got on board and then found out, hey, we missed the deadline. We want to do this. So we started one actually in July of 2020. And then you can see the rest of the cohorts. We're a calendar year cohort program. And we had several successes with this program, the way that we've done this. Again, we've had individuals from over 30 different countries, over 180 scholars. Dr. Kathleen Carissa, who's actually on the board now of Nursing Now, was one of our first one of our first cohorts at Sigma's Nursing Now, or Nightingale Challenge at the time. And Amin, also from Mexico, was one of our challenge participants as well. So we've had participants, as you can see in the map picture here, from Australia, Brazil, Colombia, Ghana, India, Kenya. You can see all the different ones that are there: Nigeria, Pakistan, Philippines, etc. So we've loved the fact that we've had a great reach with this particular program. So the way we designed the program itself is, again, we've come up with a 12-month program, and we pretty much meet synchronously all around the world, as you can imagine, but synchronously at least once a month. Typically, it's twice a month that we have an offering, and we kind of offer that same information twice. You can see some of the leadership or the curriculum information that is here of how we've developed this information. But we go through a lot of different roles and a lot of different information, whether it be from in terms of the 4 areas that Professor Holloway was talking about in terms of networking and just basic leadership education itself. So all the way to personal and professional identity branding, bullying and incivility, media training, nurses working in the UN, the United Nations. Sigma itself has a specific consultative status with the UN. So our representatives that are on our United Nations task force actually come and talk and speak with our scholars and actually go through information with them. We also, along with this curriculum that we also provide information in terms of nursing continuing professional development courses. So individuals that come to our courses, at least, or our program, get access to the Transformational Leadership Program. And again, as Professor Holloway said, this is really kind of geared towards those first years or so as a nurse. So we provide the program, Surviving Your First Year as a Nurse program, to all of our participants, which goes through these different, each of these different courses that are involved in that particular program itself. One of the big things out of our program that kind of set us apart initially, because we were one of the first associations that asked Nursing Now to actually be able to do a Nursing Now challenge, or a Nightingale challenge at the time. And one of the things that we actually saw as some of this that helped our participants or our scholars much easier was the fact that we provided them the access to mentorship. We actually developed a formal mentor, a career mentor for them for the entire year that they were in our program. Now, with these mentors, it's kind of gone all the way across the board. We've had people that have been with their mentors because we told them they had to for the time frame that they were there, and that's okay. People do that. But we've had some of these individuals that have stayed with their mentors since the beginning, and we actually highlighted some of these conversations and some of these what we call dyads at Sigma's International Nursing Research Congress that we held in 2022 in Edinburgh, Scotland. And we had several of the individuals, the mentors as well as the mentees that were there, both at the event, they actually held a session to talk about what they have learned through the Nursing Now Challenge. And then they had actually developed their own research, and have many of them that were together like that. Many of them have published papers and are still publishing papers even now to this day related to the work that they started when they came into the Nursing Now Challenge itself. So we're really kind of happy that those kind of things have really started and really came into fashion, if you will, really noting the fact that people are meeting together and really staying together based on that networking component that Nursing Now Challenge actually provided them. This last year, we decided to go ahead and make a change because it's been several years that we've done this. We didn't want to regurgitate the same information the entire time, of course. So we actually developed a new curriculum based off of Sigma's new Global Nursing Leadership Competency Framework. Now, if you haven't heard of this, this framework itself is a unique evidence-based leadership competency framework for the global nursing workforce. So it is very specific to nursing on an international level. It was developed in collaboration with nurse leaders from around the world to be used literally by nurses from all career levels. It provides them with the self-assessment to be able to develop individual leadership development plans. And we utilize this framework in conjunction, of course, with a mentor that they have, that these scholars have. The framework itself is developed to be future-oriented so that it can be used by clinical employees or employers to establish professional development opportunities, to be used in academia. It can be used to map leadership programs, like ours, of course, and show that they will stand the test of time. The framework provides an essential behavioral indicators for nurses from early career novice levels through global leaders and what we call luminaries. There's 7 different domains and 3 different lenses that were developed by these world leaders, nurse leaders around the world for this particular competency. And just to give you an idea, this is just a basic example. So each domain itself is written through one of those 3 lenses within the specific competency itself. Again, this is just an example of one of the competency definitions, specific obviously to political savvy lens for nursing related to policy decision and decision making, and how nurses at each of those different levels, whether it be novice, whether it be competent, whether it be expert or luminary, and what kind of things that they actually do or should be able to do at those particular levels. So it gives people the ability to look forward if they rank lower or higher in those particular areas. With the Nursing Now Challenge, the curriculum base, we've actually, again, developed it differently this way, and we kind of done what we call essentially is a flipped classroom model, right? So before we actually have our synchronous events, our synchronous meetings, the individuals, the scholars themselves actually do individual preparation. So they review video preparation, they view information related to the topic that we're talking about. And then 2 to 3 individuals within the program are then actually asked to present specific information. During the meeting, they present that information, they lead the discussion. So as a facilitator, I am literally behind the scenes. I let the students themselves, or the scholars themselves, do the presentations and lead the discussion itself. And then afterwards, they take that discussion back to their mentors and actually to their practice settings, wherever that is, whether it be academia, whether it be clinical, wherever. And this program so far has actually utilized or helped a lot of individuals as they have started through the program. So some of the information that we have them prepare for, let's say, one of the last ones we had about 2 months ago or so was the World Health Organization's, they had to go through the Global Strategic Directions for Nursing and Midwifery 2021 through 2025. And the scholars chose one of the 4 concepts, whether it be education, jobs, leadership, service delivery, as they related to their own institution. And that's how they developed and educated their peers, one on that particular area, and moderated the discussion between the scholars. So people get a lot of information related to that. We've had others where individuals have had to identify specific SDGs that then specifically relate to their practice in their areas. So it really kind of elevates the conversation and lets people know what's going on from that standpoint. With the Global Nursing Leadership Competency Framework, we're currently in the implementation phase, of course. We've disseminated the information that is out there. We are providing an opportunity for individuals to provide feedback. We have this particular framework available in 8 different languages, which is very, very nice for us to be able to do that, I guess I should say. And then we're also looking for specific feedback on individuals. Once they get into the framework, they can give us feedback on what makes sense and what doesn't make sense, so we can always continue to improve upon them. With this, obviously, we could not do this alone. We, Sigma, could not do this alone by any stretch of the imagination. So we have multiple areas and multiple organizations throughout the world that have lent their support for this. And you can see those individuals are those organizations on the screen, and individuals that have worked with us from multiple universities to the ICN, to Chapago, et cetera, throughout the world that have done that for us. Again, if you're interested in this particular model, I know we have the link put into the chat here as well, but you can also use your phone to download the framework itself here, just so you can understand your own strengths, weaknesses at each stage of your career. But again, this is how we have based our Nursing Now Challenge on this particular curriculum. Again, it's our pilot for this particular section, and we're really hoping to be able to take it to the next level and really kind of illuminate the scholars that we have in our program. And that's what I have for everybody. Thank you.
Wonderful, wonderful. Thank you so much, Matt. A phenomenal piece of work. Fantastic resource, and really well described. So this is available. I think we're going to make it available as a resource on our web pages. And obviously, as Matt says, as a member of Sigma, you will have that experience also. So we're all about making it available to everybody and working together. So hopefully some of you will enjoy the benefits of it. Thank you so much, Matt. We'll take maybe some questions at the end. I'm seeing that we're a bit like this morning. I'm very bad at timekeeping here. We need a little bit longer, but we're going to head straight over. Now I'm not sure. I just need a little help here because Amy is now here. So Amy, is it you next?
Yeah, I'd love to take over.
Thank you so much.
Yeah, thank you. And thank you, Matt. That was amazing. I know a few of us in the Nursing Now Challengers Committee, myself included, are right now doing the mini global advocacy program through Sigma. It's a 6-week program for anybody else interested in global health. It's absolutely incredible. So far, would highly recommend it. And Sigma just has so many awesome resources. So thanks again for sharing all of that.
Thank you. Thank you.
Happy Nurses Week to those of you celebrating. I know I've been celebrating all week. We have a couple award winners here with us. Actually, my boss, who's here with me today, won a big award this week as our Nurse Leader of the Year. And I saw Sana is in the chat as well, and she also received a Nursing Times Award, which is so, so special. My name is Amy Staley. For those of you I haven't met yet, I currently work as a clinical nurse manager at New York Presbyterian Hospital, Weill Cornell in New York City. And I also serve as co-chair of the Nursing Now Challengers Committee, where I work to empower and amplify the voices of our nurses alongside my colleague, Clarissa, who's not here with us today. I know you guys have been celebrating. I've been celebrating as well, but I have yet to see a celebration this year that truly gives a bird's eye view into the care that nurses deliver 365 days a year, 7 days a week, 24 hours a day in 24 different time zones. It's amazing to think that at any given second, you can cross into another time zone anywhere in the world and find a nurse delivering care, regardless of outside circumstances, hazards, or natural disasters. I know for those of you who live in New York, the weather is insane today. It's pouring rain outside, and you could say that nature is a force to be reckoned with outside, but those who say that would have no idea of the power and influence that nurses are having inside these spaces that remain unwitnessed and unrecognized by many. So today, I'd love to invite you to see some insight into the unstoppable force of the Nursing Now Challengers Committee. The committee is made up of 6 regional hubs to represent the 6 WHO regions. So we have the Americas, Africa, Eastern Mediterranean, Europe, Southeast Asia, and Western Pacific. And within these hubs, individuals are provided with unique access to the network to connect with nurses all over the world. Oftentimes, our regions partner with each other on different projects and initiatives. So to highlight a few, in our Americas region, we have Amy Horcasitas, who is one of the United Nations Sigma Youth Representatives. She travels from Mexico all over the globe to advocate for health equity. In Africa, currently our regional hub is home to nurses like Zipporah, Mohammed, Maureen, and Cecilia, and they're advocating directly with government agencies and ministers of health. Our European region is just as impactful with nurses like Andreas and Malgorzata, whose research and innovation have reached countries that they have yet to even enter yet themselves. Our Western Pacific hub is growing thanks to Tsung Po, a nurse from Taiwan who offers a new and holistic approach to healing, seeing beyond the diagnoses of each patient. In our Southeast Asia hub, Ernest is breaking down barriers to the mental health crisis all over the world to benefit the lives of his patients and nurses alike. And then lastly, of course, our Eastern Mediterranean region, home to the incredible Sana and Zabe. Just last week, as I mentioned, Sana was the proud recipient of the Learner of the Year Student Nursing Times Award in recognition of her invaluable contributions to the nursing and midwifery community. So I too have experienced abundant opportunities from this community. Because of the Challengers Committee, I was provided with the opportunity to take my advocacy efforts from New York City to the United Nations General Assembly. And I always believed that nurses would be in these rooms impacting individuals in policy. I just never knew that they would be us. And in addition to this network, as a member of the Challengers Committee, you get access to the Nursing Now board, which was mentioned earlier as well. These are just the most amazing nurse leaders who collectively hold more insight and experience than I could possibly fit into a webinar. And then all of our incredible challenges, our book club, the pandemic accord that was mentioned earlier, health action trainings. There's really just so many opportunities. And so if there's one message that I would want to leave you here with today, it's that you are the product of something completely unstoppable. And if you weren't ready, you wouldn't have this opportunity. If you weren't capable, you wouldn't be here with us today. And as a member of the world's most trusted and most powerful profession, I hope that you saw yourself in some of the stories that I shared today about our members, and I hope that you'll consider connecting with us. So thank you for your influence and for the immeasurable care that you provide in your individual worlds and beyond. Nurses are certainly a force to be reckoned with, and I'm very grateful to share this profession with each of you. So happy Nurses Week.
Fabulous, fabulous. Hopefully I could see the smiles on the people on the screen that are just here, because when you're listening to Amy, you're like, okay, I want to be a nurse. And you realize, remember, you are a nurse. It's so wonderful. And Sana put, Amy is one of our best nurse storytellers, and she is hugely inspiring. Every time she speaks, it's like sort of, I don't know, it's like lying on a hammock in the breeze, just listening to all the wonderful things about nursing and inspiring us. And if that hasn't inspired you, then nothing else will. So thank you so much, Amy, for all you do. And hopefully that gives you a sense of the wonderful work that Amy undertakes as part of Nursing Now. And I think what is so lovely is that she also has talked about Sigma, and I think that's a nice example of how organisations actually can work together and support each other in our profession, because we certainly need it. And we are moving to our newest member, Aaron, who I know personally. He's one of my students. I say my students, he's everyone's student here, but I like to say he's done my class, so then he becomes my student. And I've enjoyed that very much this year, meeting him. And he is now obviously with us in a more formal capacity. So over to you, Aaron, and you have the floor.
Hey, well, thank you, Aisha, for the kind words. Good morning, good afternoon, and good evening, everyone, wherever you are. Before we delve into my part of today's webinar, I want to take a moment to express my sincere gratitude to the Program Director, Professor Aisha Holloway, for providing me with this wonderful opportunity to address you all. It is truly a privilege to be here today as we come together to explore the Nursing Now Challenge and its implication for the Western Pacific region. Hello everyone, my name is Tsung Po Huang, and I'm from Taiwan. 大家好，我是黄崇博，我来自台湾。I'm delighted to have recently taken on the role of co-chair for the Western Pacific region. Nursing has always been close to my heart, and I am excited to embark on this journey with all of you. Through Nursing Now Challenge, I had the incredible opportunity to meet with some brilliant people who have inspired me to make a difference. Their passion and dedication to nursing and healthcare have fueled my own commitment to this cause, and I am honored to be in position to contribute further to our collective goals. The Nursing Now Challenge is like a rallying call for nurses worldwide, and here in the Western Pacific, it's no different. It's a platform where our voices can echo, where we can share stories, ideas, and solutions, and most importantly, a network where we can make a real difference. In my own journey, I have the privilege of meeting and working alongside some of the most dedicated and inspiring nurses in our region. From bustling cities to rural districts, the commitment of our nurses to provide the best care possible is truly humbling. But as we all know, challenges exist: limited resources, outdated practices, and sometimes even a lack of recognition for the vital role as nurses play. As a co-chair for the Western Pacific region, I see these challenges not as roadblocks, but as opportunities for us to come together and enact positive change. So here's what I envision for our region: a vibrant community of nurses supported, empowered, and united in our mission to improve healthcare for all. To realize this vision, we must foster a culture of collaboration and innovation within our healthcare systems. We must invest in the education, training, and professional development for our nurses, ensuring they have the skills and support needed to deliver high-quality care. But perhaps most importantly, we must cultivate a sense of unity and solidarity among nurses across the Western Pacific region. Every voice matters. Every advocacy effort is valued. And together, we can amplify our impact and create lasting change. By joining us in this endeavor, you are not just becoming a member of our community, you are becoming an essential part of a movement that values and amplifies your voice and advocacy effort. Your experience, insights, and ideas are invaluable as assets that will shape the future of nursing and healthcare in our region. So here's my call to action for you all. If you're a nursing or midwifery student or an early career nurse or midwife, join us, be part of this movement. Let your voice be heard, your ideas shared, and your passion ignite change. Together, we can build a brighter future for nursing and healthcare in the Western Pacific region and possibly cross-region collaboration in the future. And in closing, I want to thank each and every one of you for your dedication, your passion, your unwavering commitment to nursing. It is an honor to stand alongside you as we embark on this journey together. And thank you for all of your attention and for being part of this very important conversation. I wish you all happy International Nurses Day and Mother's Day in advance. Thank you.
Wow. Oh gosh, I can't, I'm smiling so much, my cheeks are hurting. So we've just seen Matt's probably thinking the same as me. You're like, wow, check these kids out. It's amazing. The world is in safe hands. The world of nursing is in safe hands. This is the thing. So we've just had Amy knock it out the park, and then now we've just had Aaron. It is phenomenal. It is phenomenal. Yes, Aaron. Well, I'm telling you, I know how great he is because I've heard him speak in my class. And to come after Amy, that is not an easy thing to do because she's phenomenal. So we've kind of almost like, wow. I wish we could get you everywhere. And I'm telling you, there are Amy's and Aaron's in the chat. They're there. That's what we want. We want more of them and having them, I guess, their voices heard. It's just wonderful. Aaron, that is just the most wonderful, beautiful narration you've given there of the value of nursing, what we offer, and I'm so pleased. You know, it was wonderful, and Matt, an amazing presentation on that leadership work. I can't tell you how. I mean, that work is phenomenal. And all the things that Sigma do, I love Sigma, and to come together and to be able to share this and want to share it is just so generous. And I think it's the very essence of Sigma and what it stands for. So thank you too. I would really encourage you to be using this resource, tell your colleagues. These are all things that we need. We need to invest in ourselves, and we need these resources to ensure that we are guided and we feel held. I think that safety net underneath us while we explore ourselves and understand ourselves better. So that's been absolutely just a most wonderful welcome webinar. We should be running these every day. And thank you so much, everybody. And also to Hannah and Faye in the background, and all our supporters who are with us in the audience today. Now, do we have any questions? Has anybody got any little questions for Aaron, Amy, Matt? Is there anything? I don't think so. I think we've all just sat back and just absolutely enjoyed that bit of compassion for ourselves. And I feel like I've just had some lovely therapy there for an hour. And when we're listening to all the negativity out there at the moment, it's harrowing, it's harsh. Every day you think it can't get any worse. And these last few days have been really tough if you look at what's going on in areas of conflict, particularly. Where women and children in particular are really suffering, and our healthcare workers are also, and our hearts go out to them while we celebrate. We understand there's loss, there's pain, there's tragedy, and there's unimaginable things going on, and it is with a heavy heart. But as healthcare professionals, as much as it's difficult, we're not new to some of this. And this is the reason why we need things like Sigma Nursing Now Challenge, because our careers are facing this every day. And the emotional labor I talk about, I can't emphasize it enough, is significant burden for us. We have to take it home, we have to process it, we have to manage it, then we have to get back up the next day and care again. And that is a very difficult thing to do, and to carry on and on and on. And to do that, we need support, we need cherishing. And I guess Sigma Nursing Now Challenge offer that space. So my parting message is, hopefully you've heard something today that has ignited something in you. If you haven't been ignited by Matt, Amy, and Aaron, you obviously didn't have your volume on, because they were wonderful. And that's so lovely. Hannah's just put in, we cherish you all. And we do. And thank you so much. I don't know how we've managed it, but we've managed to finish on time, not because of me, but because Matt and Aaron and Amy are so professional and have managed to get us back on track and finish at 4 o'clock. So thank you so much today. I really would like to wish you the very best, and I hope that you can come and be part of our community. Until next time, until book club, until Wellness International Day, until one of our many other things that are happening, and from Sigma also. Matt, I don't know if you wanted a last word there for Sigma.
No, I appreciate that, and completely agree with everything that you're saying. I'm kind of thinking now, my presentation was like well at the bottom compared to these other two. So I absolutely greatly appreciate the information and the stuff that you guys are doing, and the passion that obviously comes through and shows. Yeah, so from a Sigma standpoint, we are very appreciative of Nursing Now, very appreciative of the partnership that we have, the working back and forth, Fresh Holloway, as well as the staff there as well. And we want to continue this partnership and moving nursing forward, as we all have been over the last several difficult years, as we know, but being able to do that. So we greatly appreciate that.
Lovely. Thank you so much. Thank you. That's very kind. We couldn't do it without each other. And people are asking in the chat, how do you join? How can I be part of Nursing Now? Ellen, I work in academia. You can. I work in academia and I'm part of Nursing Now. Your institution, your university can be part of it. So if you're an individual and you don't have an institution that knows about it, join as an individual. We will help you get your institution. You need your institution to give you that infrastructure. We can help you with that. Your hospital could join as well. Please email challenge@nursingNowGlobal. You heard it here first. Okay, have a great day and hope the sun shines in New York. Take care, everyone. And Aaron, thank you so much. Well done on your inaugural. Thank you. Bye. Take care. Bye. Thank you, everyone. Bye.